Hello, Mary here. Welcome back to Lesson 2 of this series about diabetes. I hope that you enjoyed Lesson 1 and completed the action steps I asked you to work on before you start this lesson. Follow along in the manual I have provided to keep this information handy and to help you follow through the course and make changes for the better. In the last lesson, we focused on the basics of the disease and how it was correlated to lifestyle through historical observation. We briefly touched on the role of insulin and the classification of the different manifestations of the disease. As we move into Lesson 2, I'm focusing on the direct cause of type 2 diabetes. Type 2 is most closely related to lifestyle, so that will be our focus throughout the lessons. Type 1 diabetes and gestational diabetes patients can also benefit from the lifestyle changes I will introduce to you. So, in this lesson in particular, I will be defining the role of insulin as well as insulin resistance and what this might mean for you. I will also talk about what symptoms are generally found with this disease and what you can expect to feel if you have insulin resistance or diabetes. Remember, too, that every person is an individual, so all symptoms will vary from person to person. As we progress through the lessons, I will be consistently focusing on personal choice. You may be making choices in your life that contribute to the onset and advancement of this disease. And this is why I asked you to make a list of your habits, both good and bad, helpful or harmful, to start determining what is happening for you personally. Keep this course guide handy. As we go on to lessons 3 and 4, I will be sharing important dietary choices with you and ways to protect and heal yourself. So lesson 3 is all about foods that advance diabetes. Some of these choices will seem obvious to you, but there are some foods that are commonly recommended by the established medical community that might not be in your best interest for recovery and reversal of this disease. We will cover so much about what to eat and why that is important. Alright, lesson 4 is all about instilling change. This is what most people consider the hard part. Remember, it is all about creating change in small steps. One day at a time is how diabetes develops, and we can make changes in the same ways. Connecting the foods that you choose and the daily activities you create for yourself and your family is so important in that first step towards recovery. Find out what is causing the progression of disease so that you can make the informed decisions to commit to change. By having the why, the underlying root cause, you can confidently make better choices. I will show you how to take charge and implement change one step at a time. So, getting into the root cause of type 2 diabetes, how does it occur? In both type 2 and gestational diabetes, the insulin produced by the pancreas is not sufficient enough to drive the glucose out of the bloodstream and into the cells. The body can also be unable to use the insulin produced by the pancreas properly, keeping it from entering the cell. There is a very strong link identified as the cause of high blood sugar in type 2 diabetes, and it may surprise you. It is fat, not sugar, that is the underlying problem. Excessive body fat and circulating fats in the blood are the likely cause of poor insulin production or assimilation. The extra sugar in the blood happens because the insulin can't enter the cell, causing more and more sugar to accumulate in the blood. The fat surrounding the cell keeps the key out of the lock to allow the glucose to enter. Eating excess sugar compounds the problem, but is only one part of the overall dis-ease of the body. So, how does this lockout problem occur? For blood sugar to be at a consistently high level, you must have developed insulin resistance. In fact, the precursor to diabetes is insulin resistance. Insulin resistance is the failure of target organs to respond normally to the action of insulin. There are some standard factors that contribute to insulin resistance, such as genetics and aging, but it is the acquired factors that are important to note. Obesity, or too much fat on the body, a sedentary lifestyle, a high-fat diet, certain medications, and chronic stress are all very strong contributing factors. There are plenty of people with genetic predispositions, and of course many older people who never get diabetes. Lifestyle trumps genes when it comes to insulin resistance and diabetes. Did you know that 40% of Americans are insulin resistant? I have so many clients that discuss with me how hard it is for them to lose weight and how tired they are consistently. That is because their bodies are fighting against accumulated fats and the burden it places on the body. This problem is part of a larger disorder called metabolic syndrome. Type 2 diabetes is one of the diseases associated with metabolic syndrome. Illnesses that are attributed to insulin resistance and metabolic syndrome are glucose intolerance, obesity, especially fat deposition around the waist and trunk or midsection of the body, atherosclerosis or hardening of the arteries, polycystic ovarian syndrome, thyroid issues, and liver issues. Let's take a look first at being overweight. You have probably heard the statistics. According to the Center for Disease Control, 36.5% of Americans are now classified as obese, with higher prevalence in certain populations, such as African American, 48.5%, and Hispanic populations at 42.5%. No ethnicity is spared, however, and we find that studies of immigrants prove that moving to America and adopting our lifestyle also changes their weight and physical health. Overall, 70% of Americans are classified as overweight. It seems to be a common part of our society. I want to point out to you how it is often seen as normal, but the health problems we are addressing here shows us that it is a problem of health and wellness, and emphasizing it is not intended as belittling or hurtful. Learning about the problems associated with being overweight is a great way to start considering how we can solve our issues associated with weight and its correlation to poor health. Remember that this is just one problem associated with metabolic diseases. Let's now look at another problem associated with metabolic syndrome. Hardening of the arteries, or atherosclerosis, refers to a whole series of ailments such as dementia, high blood pressure, erectile dysfunction, strokes, spinal problems, and heart attacks. How many people do you know that have suffered from these problems? In my family, every single one of these issues has been present. My father has spinal problems and previously suffered from heart disease and had 2 different open heart surgeries. My grandmother had a series of strokes. My cousin suffers from Lewy body dementia. I could go on and on. I recently had a friend confide in me that he had been suffering from erectile dysfunction since he was diagnosed with high blood pressure. Atherosclerosis is again only one manifestation of metabolic syndrome. Who else is at risk for problems with insulin resistance and metabolic disorders? Young women. PCOS. Polycystic ovarian syndrome is a disorder that also has a host of symptoms for women who suffer from this. Difficulty losing weight, acne, hair growth on the body but hair loss on the head, headaches, and sleep problems. This disorder affects 1 in 10 women of childbearing age, according to womenshealth.gov. It not only affects quality of life now for these women, but can affect their ability to bear children throughout their early adult lives. Another problem that is associated with possible infertility and is also part of metabolic syndrome is thyroid issues of all sorts. The thyroid is directly responsible for energy metabolism in the body, so it makes sense that there is a direct line between thyroid malfunction and insulin resistance. Many that report loss of energy and weight gain have both thyroid issues and insulin resistance. You will see in other courses how the thyroid plays a part in our everyday health. What other organ is affected by insulin? A really important one, the liver. NAFLD, or non-alcoholic fatty liver disease, is described as a disorder that is caused directly by the consumption of fructose. Fructose, which is a component of almost all types of natural sugars, causes a buildup of fat cells in the liver from toxic inflammatory proteins, which are located in our fat cells throughout our body. It is an important response from the liver to store fat to protect the body from toxic buildup. Our toxins are kept in our fat cells for our own preservation, to keep us as healthy as possible. The buildup of fat cells and toxins in the liver eventually leads to cirrhosis of the liver by either drinking large amounts of alcohol or consuming large amounts of fructose. The really important underlying issue of insulin resistance and then consequently diabetes is that the body is not in equilibrium. Did you know that the body is constantly trying to get back to a place of harmony? Insulin resistance is a very important sign that your body is not working at optimal speed. This is why quite often those that are insulin resistant report feeling fatigued so much of the time. So if the body is not balanced, how does diabetes affect the different parts of our bodies? The main organs to have damage from diabetes are the liver, pancreas, kidneys, and the vascular system. There is a buildup of fat within the liver, which leads to lower function and non-alcoholic fatty liver disease, as I mentioned earlier. There are often no symptoms associated with NAFLD, but the most common ones to be seen are a darkening of the neck and underarm skin and enlargement of the liver, which can be felt upon examination by a doctor. Damage to the pancreas occurs when it can no longer keep up with the amount of insulin needed to lower blood sugar to a normal level. Beta cells, which are the insulin-producing cells within the pancreas, consequently burn out. High blood sugar is a telltale sign of beta cell burnout. In the kidneys, high blood sugar damages the delicate blood vessels, which leads to less blood filtering. Toxic buildup occurs in the blood. Some important warning signs for loss of kidney function are swelling of the hands and feet, dark-colored urine, feeling tired and sluggish, unexplained calf pain, and less frequent urination. How many dialysis centers are around these days? Do you know someone who has had to start dialysis? According to the NIDDK, the National Institute of Diabetes and Digestive and Kidney Diseases, chronic kidney disorder, or CKD, has risen 600% from 1980 to 2009. It is important to recognize kidney issues and the importance of our kidneys functioning properly. There is one other important part of the body that is deeply affected by diabetes, the vascular system or blood vessels. Excess glucose in the blood causes oxidative stress, which leads to blood vessel damage. The food you consume also can cause oxidative damage. All oxidative damage is caused by free radical damage. When there are too many free radicals, the body cannot neutralize them fast enough and vascular damage occurs. When you don't have enough antioxidants in the body, which are found naturally in whole plant foods, the body cannot counteract the damage. This blood vessel damage leads to chronic problems such as peripheral neuropathy, which is nerve damage to the hands and feet typically, eye problems including blindness, lowered circulation leads to infections and possible amputations, and then heart disease, which causes heart attacks and strokes. You will learn all about high antioxidant foods in part 4 of this series. Seeing all these different problems may make you really wonder if you are insulin resistant. Reversing insulin resistance is certainly possible, so think about this list of symptoms and whether you think this might be you. Abdominal fat, cravings for sugary or processed food, skin tags, swollen ankles, acne or large pores, darkening of the skin around the neck or face, polycystic ovarian syndrome, high blood pressure, and elevated blood sugar. Take note of these symptoms and disorders. If you have several of these, you may want to consider the possibility that you may be insulin resistant. These are all signs that your body is struggling with excess glucose in the blood. Over time, the pancreas will no longer be able to keep up with the excess insulin needed to lower your blood sugar. Diabetes then develops. Here are the signs and symptoms of diabetes: increased thirst and hunger, unexplained weight loss or gain, frequent urination and sweet-smelling urine, reduced feeling in the hands and feet, feeling anxious and stressed, blurred vision, and having wounds that heal very slowly. Do you have any of these symptoms? You may or may not have diabetes, so it is important that you get evaluated if you have not already done this for yourself. What causes all these problems associated with type 2 diabetes? Lifestyle. We may not be fully aware that our choices are fueling the disease, but bringing ourselves to alertness and then consequent change will heal the body and the mind. Becoming acutely aware is the first step to solving the problems associated with diabetes. Honestly, the standard American diet and lifestyle are the root causes of the disease. Our daily food choices are a part of our society and upbringing. That does not mean they are good for us. Eating a piece of pizza at a party or just because you don't have time to cook dinner doesn't change how the body metabolizes your food. In my family, I know it can be hard to have dinner ready to go all the time, but I have learned, and I will teach you, habits that can keep the pizza man away from your door. So what other foods are part of the standard American diet, or SAD for short? A Western diet is high in sugars, saturated fats, and animal proteins, yet low in fiber. Processed food and convenience foods are disliked by the body and will create an immune response. It is very similar to smoking. One cigarette or a few packs of cigarettes will not immediately give you cancer, but many years of repetitive damage will cause changes to occur in the body. The immune response grows and becomes a larger and larger symptom and problem. The standard American diet causes changes in the body that can ultimately lead to disease in a similar fashion. Do you eat foods that can cause diabetes? That will be something you can determine in the next video. Being armed with information is the first step to change and to a quality life. We have learned so much in this lesson. Remember that every step forward takes action from you. Watching this video is a great first step to taking control of your body and your mind. But before you go to part 3, here are some easy and important action steps you can take to get on the road to optimal health. Take action now. Number 1, take the quiz to see what you learned from watching this video. Number 2, just like before, tell someone 3 things you learned. When we consider how to teach others, we learn so much more. Number 3, make a list of the foods you eat regularly. Then you can compare what you consume with what you will be taught about foods in the next video. Number 4, consider your family life. When do you choose to eat foods that you already know are incompatible with your body? Write it down and watch the patterns emerge. Number 5, be kind to yourself. As you write down information, quite often we judge ourselves. There are many different reasons we make choices, and discovering these are all part of learning and life. Punishing yourself with destructive thoughts just harms you. Self-acceptance is part of change. Take some time after this video to reflect on what you've seen and heard and consider your daily life. Be honest with yourself. Use what I've given you in the manual to reflect on and consider what to start changing. It really helps to be armed with information as we dive into lesson 3. I'm so excited and I hope to see you there very soon.